Welcome to the Duke Caregiver Community event. My name is Suzanne Mayer, and my academic background and graduate degrees are in community mental health and in taking care of children who have severe behavioral and emotional issues. But that's not why I'm here today. I'm here today as a caregiver. I have been a caregiver for 13 years for my son, youngest son, who is 36 and has been diagnosed with a serious mental illness. You may be asking yourself, well, are you sure you're not in the wrong event? Because this is an event for caregivers of the elderly. But I want to talk about how we're like and how we're different, and all the other caregivers that are out there. So, who are the caregivers? Well, we're family, usually, or friends, or a paid helper who regularly looks after a child or a sick or older adult. There are 16.8 million caregivers in the United States who are caring for children who are under 18. These children have a variety of problems. They may have severe autism. They may have developmental disorders. They may have disorders as a result of extreme prematurity. So that's a lot of caregivers. And then there are 8.4 million caregivers for family members who have severe mental illnesses. This doesn't include the people who are caring for those with severe substance abuse disorders. Now, your group is 17.7 million folks who are caring for the elderly because of dementia, or sequelae of strokes, or other physical issues. But altogether, family caregivers are 42.9 million strong. And in thinking about this, I was thinking we would be much stronger together than we are separated. I realize that the professionals have to be walled off according to age. There are those who deal with younger people, there are those who deal with adults, and there are those who deal with the elderly. They have to do that. It's too much for any person to cover the whole age spectrum. But as caregivers, we don't have to do that. We're all facing a lot of the same issues. And if we could talk to one another, we could learn so much, and we could be better advocates for our loved ones. So let's talk about first, though, how these age groups are different. Obviously, they're at different points on the age spectrum. It's very different taking care of a child than an elderly person in some respects. As caregivers of children, they're looking at decades of caregiving, whereas those at the other end of the age spectrum are probably not looking at a very long period of time. The average is 6 years. The medical and physical needs of those who require caregiving are very different. Some may have profound medical and physical needs that require caregiving that involves physical help, assistive devices, and they may be taking a number of drugs, whereas other people may not need any assistance for their physical environment, and they may not be taking any drugs. So that's a difference. Obviously, all of these millions of people have different diagnoses. So how do they fit together for us? How are they the same? Well, let's talk about how they're the same. Most everybody on this age spectrum, from a toddler to an elderly person, will probably at some point show neurological symptoms. And those neurological symptoms, it's been shown by research, are the most difficult for caregivers to deal with. Not the physical care, but the changes that happen in the brain as a result of these illnesses and conditions can cause great changes in personality. For instance, someone might have been very easygoing, very kind, very quiet before their condition manifested. But once it does, they become angry and irritable and suspicious. That's what caregivers deal with all the time, that point in time when the personality changes. And it is a really frightening time for everybody. I saw my son when he first came home from college. He was in total psychosis, and he looked like a different person. He talked like a different person. The ideas he was espousing didn't make any sense. And I was so taken aback, I wanted to say, "Stop it. Is this a joke? Are you kidding?" Fortunately, I didn't say any of those things. But that's what we deal with as caregivers. We see an enormous change happen oftentimes due to neurological symptoms. The other thing we deal with is none of these conditions have a clear cause necessarily. Alzheimer's, serious mental illnesses, other dementias, autism, we don't know the neurological underpinnings. We know more than we did 50 years ago, but do we know all of it? No, we know a little bit. We have a long way to go. So we can't, as caregivers, treat this like another illness where you start at the beginning, you do certain things, and the person's cured. Doesn't happen with neurological illnesses for the most part. We're looking at, we don't know the cause, so we can't go back in the past and think about, okay, what went wrong? And we don't know what's going to happen in the future. There's no clear path for these neurological symptoms, beginning or ending. So we can't go into the future either. We're stuck right here and now, which is a good thing in some ways. It keeps us in the present, but it keeps us in the present with a lot of questions about what do I do now? When you deal with professionals, and the professionals have helped me very much with my son's condition, but they're not there 24/7. I'm dealing with symptoms on a daily basis, and I'm sure you are too. There are symptoms that aren't predictable. There are symptoms that don't have a time limit. There are symptoms that may be very difficult to intervene in when somebody, let's say, is very paranoid or angry as a result of that. So, what are the conditions that are the hardest for caregivers? Let's look at these. So when people have significant brain changes, and one thing that a lot of these conditions have in common is those brain changes are in the frontal cortex. And the frontal cortex is very important for all of us in terms of planning, carrying through on tasks, being able to think about our own thinking. And by that I mean being able to say, well, I thought that's what happened, but maybe it isn't. Maybe I should check that out. We can do that via the prefrontal cortex. But those who have neurological difficulties there cannot. So what they believe, they cannot check out. And I want to talk a little more about the paranoia in just a minute. Another common symptom is withdrawal. People understand, even young people, that something is happening to them, but they can't get a handle on it. They can't figure out what it is. And they withdraw. They don't want to be around people because they don't have those skills to interact that they may have had previously. People may also become restless with these conditions. They want to do things, but that planning ability isn't there. So they may pace, they may go out and walk a lot, they may take off without telling anybody. One of the conditions that's also very common with these conditions is called anosognosia. And what that means is that the person does not think they are ill. This is, again, very common, not denial. It's just damage to that prefrontal cortex that makes people not able to look at their own symptoms. So there's a lack also of planning ability, like I said, of simple tasks that somebody may have been able to do before, like putting a load in the laundry, may have more steps than the person can take at that time. They may put the clothes there in front of the washer, and then they walk away. They don't realize there's more steps to the task. There may be inappropriate social interactions, because of them living in a different reality. They're not sure how to interact with people all the time, even people that they've known for decades. Another part of that is unpredictable behavior. Like I said, they may take off walking and you don't know where they are. They may spend a lot of money because they just want to. They may do lots of things that you wouldn't have thought, okay, the next thing they're going to do is this. So the underpinnings of all of these behaviors is often delusional thinking or hallucinatory thinking. So hallucinatory thinking involves seeing things that you think are there, but in reality aren't. Delusional thinking involves ideas that you have about how the world works that are not shared by other people. The more the damage to the brain, the more likely you are to see these behaviors, these delusional and hallucinatory behaviors. And this is very difficult for caregivers to deal with. So how do you do that? How do you deal with this person that has a totally different personality than they used to? They believe in things that to you aren't real. They may see things that aren't real. As I said before, my first inclination was just to say, stop it, don't do that. That's not true. But that's the tricky part, because you have to learn to talk with people who have neurological damage in a very different way than you would talk to a friend or another relative. You can't attack these ideas, these delusions directly, because it would be like me saying to you, I know you think you're home, watching this video on TV, but you know you're really not. You're really in this room with me. You just don't know it. You would say, oh, no, I'm not, and you'd get very irate. Well, they do too, because for them, the reality they're living in is just as real as yours. So, the most important part of new communication skills is just questioning, just trying to get a handle on what it is they're believing at any particular time. So just saying things like, wow, that must be really stressful to think that that man outside is here to hurt you. How could we check that out? You're not agreeing with the delusion, but you are saying you understand their feelings. And you can further check those delusions out by coming up with a plan. There's a very well-known book that the National Association on Mental Illness recommends by Dr. Xavier Amador called I'm Not Sick, I Don't Need Help. We hear this a lot from our loved ones. And this is just one of the many, many techniques that are available to us. His involves the acronym LEAP. It involves listening, empathizing, agreeing with what you can, and planning how you're going to deal with it. There's also communication strategies like you always making I statements instead of you. We're used to talking in you statements. We say, you were supposed to go get that at the store for me. Why didn't you? You shouldn't be doing that right now. You need to come here right now. But the problem with you statements, even though that's our default measure of communicating, is that it puts the onus on the other person. And it immediately gets their defenses up. So what works better is to say I. Here, it really stresses me out when you leave and I don't know where you're going. I would really like it if you could tell me before you leave. You always come from your own viewpoint. Another communication skill is, and it's always very important, is saying back to the person what you hear them saying. You might think you know what they mean, but you've got to probe deeper. You have to say things like, so what I'm hearing is you're thinking that that man outside is here deliberately to come in and hurt you. Have I got that right? So you're just checking, you're questioning, you're listening. Those are such important skills. Will it solve every problem? Sure won't, but it will make your life easier. Will you make mistakes? 1,000 times. I've done it over and over, and you have to forgive yourself. The other person won't break. Life will go on. It's okay. The last thing that I want to share is I hope you can think of ways that we all can to interact with one another across the age spectrum. Because although I've learned a lot from professionals, from reading, my best advice has come from other people who are caregivers because they've done things that I hadn't thought of. They've read things I hadn't thought of. They know about medicines that I didn't know about. So that is extremely helpful, and I hope that you can find a way to interact with all caregivers. The other thing that I want to say is the most important thing is that you take care of you. I know this job is so difficult. You get tired, depressed, angry, irritated, all of those things. And it's very hard to lift yourself back up again, which is another reason that you need to talk to other people, to have a group to help you with that. But the most important thing is you have to be well and take care of yourself, or you're not going to be of any use to the loved one that you're taking care of. You have to take care of you. As NAMI says, put your own oxygen mask on first before you try to take care of another person. Thank you so much. You are amazing, amazing people.